There are non-invasive procedures that can take years off of our face. So Dr. Mejia and Sarah, what can lasers do for us?
Latest in technologies are what's called intense pulse light treatments. This is the Luminous 1, and this is a device that has many different features to help remove brown spots, red spots, spider veins in the face. This allows us to do different treatments of vascular lesions, pigmented lesions, hair removal, wrinkle treatments, and skin tightening. It allows you to select different parameters to ensure the safety of skin. You can see the different skin types in individuals, and you can select the skin type that you are. That's whether you're very fair, whether you're dark skinned or medium skin.
What would my skin type be?
In some cases, we'd have to ask a question of whether you get sunburn easily, whether you tan easily, but in general, I would probably put you close to about a 4, skin type 4, just for safety, okay? Very, very light, fair skinned people are 1, darker skinned people are skin type 5. But here we can select what different type of treatments, whether we're treating facial telangiectasias, leg veins, hemangiomas, or blood moles, either shallow, medium, or deep, to allow you to deliver the appropriate treatment. So the nice thing about this design is it's got a lot of safety features to ensure that we deliver the appropriate treatment for different skin types. You can treat people who are concerned about brown spots, or people that got aging spots on the hands or the arm. You can go to pigmented lesions.
So this one machine can do all that?
That's correct.
Vascular lesions, hair removal,
yes,
pigmented lesions.
Pigmented lesions, brown spots, age spots, what they call liver spots on the hands. And then you can actually pick the different parameters, whether they're brown spots, whether they're light or dark, cafe au lait spots, hyperpigmentation. That's right. Those are. That is cafe au lait is actually kind of like a very brown, like a light colored tan stain on the skin. It looks like almost like a large mole or a large area of discoloration. Not like melasma, but it can be just like a mole, like a large flat discoloration of the skin. Some people would think it's a mole. And for example, if you're treating those spots, you can pick a different skin type. And if it's light skin, and then you get okay. And this tells you different parameters. And then it will actually give you preset parameters that are used for safety, and it'll give you the energy, and then we can treat people accordingly. Okay. And then for comfort, we have different ways that the energy is delivered, whether it's single pulse, double pulse, or triple pulse. This might sound a little bit technical, but there are different things that we utilize in our practice, and Sarah utilizes in her practice to ensure that we deliver the appropriate energy in a comfortable setting in a safe manner to get rid of brown spots or blood vessels and/or for photofacials. And this device is what delivers the best IPL photofacials. That's a term that you commonly hear these days.
I hear it all the time.
Yeah, and photofacials is a light-based treatment to help rejuvenate the skin through stimulation of the collagen and the elastin.
What is the downtime for that photofacial?
Depending on the settings, typically you want to start out a little bit less aggressively. I mean, people go back to work the same day. You're typically a little bit pink, a little bit peely, but no real downtime. You may have, a little bit of pink or redness, but nothing major.
Is that what they call the lunchtime facial?
Yeah, I mean, pretty much. I have most of my patients, they come in, they go back to work, they can put makeup on right afterwards, so it's really not a big deal.
So the lunchtime photofacial.
Oh, okay, yeah. Photofacial,
That's
okay.
Right. Okay. Now, if you're treating brown spots on the face, then you might have a little brownish discoloration, and it'll turn darker, and for the next week, it'll be a little bit more obvious, those brown spots, and then they'll flake off and then fall off.
Do you do the whole face, or do you target where the brown spots are?
Normally you want to do the whole face so you get all the brown pigmentation, because you don't want to almost take some of the pigmentation from the background and leave a spot. So typically I like to do